Hello, this is Stuart Felton, President of Life Safety Products. After 3 years of personally conducted intensive market investigation, surveys, and research, I decided, collaborating with a team of knowledgeable specialists in a variety of professions, to recreate the most important item that everyone should carry at all times, proving to offer the most incomparable, superior, life-preserving benefits utilizing 21st century state-of-art technology. Perfected by the College of Emergency Physicians, a data form includes all medical history, profile, plus a consent authorization to render any necessary first aid, blood transfusion, and/or emergency surgery. It also contains annual updates of health insurance policy coverage and other essential vital statistics, auto windshield decals, and an octagon-shaped key ring, metal or plastic, notifying a rescuer that you, the owner, carries a CD card or a USB card with your health history on yourself. The contents are instantly read from a laptop or desk-type computer. An alert bracelet can be purchased separately. Now, our population is increasingly mobile. So while the medical diagnosis and treatment systems are now so complex that they cannot adequately be responded to by the current paper record systems. Believe this or not, over 100 million per year hospital emergency room visits are without patient records. 200,000 people die each year from medical errors, primarily because the doctors could not access vitally needed information in a few golden moments after arrive at the emergency room. Annually, millions of unnecessary and erroneous medical procedures are performed due to lack of patients' current medical information and their history. And believe it or not, also, 40% of the yearly bankruptcies are now due to health expenses incurred. Lifesaver Card is a life-saving technology whose time has come. Complete medical history is in the palm of your hands. It allows instant access to you, the patient, medical information before arriving at the emergency room. It can make the difference between life and death. The problem: emergency contact. Every 3 seconds, somebody in this nation is admitted to an emergency room. The question is, how soon would you want your loved ones to know if you were in an accident, and want to know if your loved ones were in an accident? In an emergency, how would you convey this critical medical information about your drug allergies, your medical history, your current medication, your blood type? And in an emergency, while traveling or wherever it is needed, how would you access your health status? Information is useless unless it's accessible when needed. How would you convey the life-sustaining decisions about your medical treatment, resuscitation wishes, your living will, and 1 out of 5 injuries or deaths in hospitals are due to lack of knowledge of the drugs prescribed or the lack of patient knowledge, and especially if they're traumatized. Up to 150,000 people die from medical errors each year. Adverse drug events increase hospital stays, sometimes as many as 5 days, and increase the medical bills by $6,000 per day. Almost 2 million Americans die in a hospital or health care facility each year. Of patients in hospitals or health care facilities, about 20% have an advance directive. Of these patients, only few have a copy in their medical chart. Medical history and information forms should contain your employer data, the physician employment, insurance information, your blood type, your allergies, your current conditions and medications, and much more. Lifesaver Card is a life-saving technology whose time has come. Complete medical history in the palm of your hands. It allows instant access to the patient's medical information before you arrive at the emergency room. It can make the difference between life and death. Now, information at hand provides a hospital administration with a physician and insurance information, your medical history, emergency contacts, critical medical information, and alerts the emergency personnel of any special instruction. Each customer should receive a wallet-sized ID card. It has your information, your website address, emergency personnel alert, CD or USB thumb drive loaded with medical information. So the answer is, in the golden moments, that's 90 seconds after an emergency, with the card, CD or USB drive, instant access is provided to emergency healthcare professionals and the destination hospital and doctors, because the ambulance can transmit the information immediately from his ambulance to the doctor at the emergency room. So there's no human interaction, no data entry. Only images of the original documents are processed. Physicians or nurses must sign the critical documents that are submitted. Our email address is sf@ori.net, and the Lifesaver Card can be seen at www.lifesavercard.com. Everyone can use a Lifesaver Card. Information is useless unless it's accessible when needed. Thank you for watching it.